Hey everybody, this is Dr. Jeremy Payne with Evolution Integrative Medicine, and today I wanted to talk to you about a common misconception with sciatic nerve pain. I had two patients today, and they were showing me where their pain was, and they told me about the history of it and things like that. And they've been to chiropractors countless times, and with no result, obviously, and that's why they're in our office. So, some of you might have gone to a chiropractor for 3 to 6 to 9 months trying to work on sciatic nerve pain, or you've done acupuncture, you've taken the anti-inflammatories, dry needling, everything, cortisone shots, all those things. And once all those things wear away and you stop doing them, then the pain persists. And I want to show you what I find in my clinic. Again, I'm differentiating between subcutaneous nerve pain and sciatic nerve pain because they're completely different, but for some people, because of where they're at, it feels the same. So this chart here, and you can see where we have these subcutaneous nerves that exit all these areas here. Again, this is a generally overviewed type of image, but it's pretty good, and I try to follow it as much as I can. But if you look here, the sciatic nerve really kind of comes off of this location here, and it drops down and it goes through the center of the glute, and then it drops down to the center of the hamstring, and then it drops all the way down and keeps going down this way into the foot. So if you have symptoms that are running down into your foot, numbness, tingling, that type of thing, or pain coming all the way down, then maybe it could be a sciatic nerve. But to be honest, what I've been finding since I've been doing the subcutaneous nerve injections for the past 4 years is that it's important to differentiate and to differential diagnosis what the problem could possibly be. So when we look at this picture, you can see these nerves are called the superior cluneal nerves, and you can see how they drop down into the glute area and they move into the leg. And then we have these nerves called the medial cluneal nerves right here. And actually, they're a little bit longer. I'm going to show you a picture in a second, but they're a little bit longer. And when they come out this way, then below here are the inferior cluneal nerves. And they come out from the bottom of the ischium or the glute, and they travel up into the glute area. And lastly, we have the lateral femoral cutaneous nerve, which you see it right there. And it drops out from the side of the hip and it goes all the way down the side of the leg. And so what I'll find is I'll ask people to show me where the pain is, not just tell me that they have sciatica, because as soon as they do that, I say, well, show me where it's at. And they always take their flat of their hand and they run it on their backside here and they go this way. Never fails. The two people I saw today, that's exactly what they did. Two people last week, same thing. They brought their hand out to the side, and I asked them, do you have any pain in the center? And in my exam, I'll put digital pressure right here, and there's no pain. And then I also look at, well, if I go to the center of this, is there pain? And there's none. And to be honest, these nerves sit a little bit further out this way. And then I'll palpate down the side of that hamstring on the outside, and they just jump off the table. And so actually what they're experiencing is subcutaneous nerve pain, or so they're having neuropathic nerve pain is what's going on. So let me show you a little bit of a bigger picture here of this. So one of the superior cluneals, and you can see how it exits the muscle tissue right here, and it drapes over the ilium or the pelvic bone right there. And a lot of times when I put digital pressure right there, they jump off the table. But then when I go to the glute in the center, there's no pain. I mean, it just never fails. I ask them, is there any pain there? And they say no. But when I push there, they jump off the table. When I push up against here, against the sacrum, they always jump off the table. And I would say half of the patients have pain right there coming from the inferior cluneal nerve. So again, I'm going to show you another picture, get a better idea of this. To be honest, I love this. When I found this out, it was something that just changed my life to help people, and I've changed a lot of people's lives looking at their sciatic nerve pain, which is actually coming from their subcutaneous nerves. So when we look at this, you can see the superior cluneals are exiting through these muscles here, coming over the top of the pelvic bone. And anytime there is some type of entrapment and the nerve is swollen, so I always ask, what exactly, when did this start? And they're like, I had some kind of fall, or I got twisted up somehow jumping on the trampoline and I got crushed in a certain way, or I fell off the motor, or whatever it was. And there's always some kind of traumatic event that usually leads up to this. And, lifting, doing gymnastics, dancing, those types of things will create pressure and cause enlargement and entrapment of these nerves. So this is the superior cluneal, this is the medial cluneal, and this is inferior cluneal. So again, whenever people take their hand and they show me this is where my pain is, or they'll go down the center of their sacrum, and I'm like, well, this is not sciatic nerve pain because it's not here. And you can see how deep this is so deep. I mean, this is the glute max, and there's a glute minimus that's above this nerve, and it's just not the problem the majority of the time, unless there's some kind of damage, really bad damage up in the lumbar spine. Then it's not going to be sciatic nerve pain. And so you can see how deep that is. And so when I put digital pressure in this area and they don't have any pain, typically it's not the sciatic nerve. So the other one that I like to look at too, that I kind of correlate with this, again, they're always running their hand over the side of their hip and looking at the iliohypogastric nerve. Again, I know you guys have probably never heard of these nerves before. I hadn't either until 4 years ago. And then I started to put this in my examination and finding these nerves and palpating them and realizing that the majority of people's low back pain is coming from these nerves as they're exiting the soft tissue and the muscle tissue and things like that. So right here is the other piece of the ilium or the hip bone or the pelvis. And again, right back here is where the superior cluneal nerve is going to be located. So again, if somebody takes their hand and rubs it on the side of their body like this, then I'm always looking for these nerves to be the problem. So whenever you look at and you're thinking about, wow, do I have sciatic nerve pain? Then I want you to really think about this whole process. So I hope that this was helpful for you, and I hope that it gives you some information and something to think about, because I see this a lot. And again, I'm always trying to differentiate. That's my goal as a doctor in the office, as a naturopath, as a chiropractor, to use my skills to be able to determine which nerve is the problem, because I love healing the nervous system and helping people heal from that. But I know for sure that, typically it's going to be coming from the subcutaneous nervous system and not the sciatic nerve. So I hope that was helpful, and I hope you have a great evening, and we'll talk to you soon. Thanks.